Presidency is Vasudhaiva Kutumbakam, one earth, one family, one future. India is aiming to build collaboration to address global challenges. India has identified a wide array of cutting-edge priorities in the health sector that are being deliberated by various G20 health working groups to plan and address the key challenges we face and to chart them for a better future. And today to discuss on India's priority areas in health sector, we have with us Dr. Randeep Guleria, former director, AIIMS, New Delhi. Welcome to the program, Dr. Guleria.
Thank you.
So, Dr. Guleria, to begin the discussion, I would like to understand from you how India is planning to leverage its G20 presidency to advance global discussions on pressing health issues and what specific health priorities will be at the forefront of these discussions.
I think India and the global community recognizes the importance that should be laid as far as health is concerned, and not only health of a nation, but global health. And this has become more apparent after the COVID-19 pandemic. So the priorities which I think are going to become important, and those are the priorities which are there for the G20, are basically first addressing the issue of health emergencies. How can we look at future outbreaks in terms of collaboration between various countries, in terms of prevention, preparing for it and having a response so that there is good surveillance to pick up any outbreak, prevent it from spreading, and be able to collaborate with countries to prepare a response as far as any outbreak is concerned. The second area which I think is important is going to be antimicrobial resistance. We are seeing a huge emergence of resistant bacteria causing infections in ICUs across the world, leading to high mortality. And therefore, there has to be a global effort to tackle antimicrobial resistance, because like viruses and the bacteria, resistant bacteria can also spread easily from one part of the world to the other. The third thing that I think we realized during the last 23 years, because of so many outbreaks that we've seen in this century, from SARS to MERS to Zika to H1N1 swine flu to Ebola outbreaks, that we have to look at the concept of one health. That is health of humans, health of animals, health of plants, and the health of our environment. Most of these outbreaks, including H1N1 pandemic and the SARS pandemic, have actually occurred because viruses have jumped species. The viruses are what we call zoonotic origin. They have originated either from animals or birds, have jumped species and become human viruses, and then caused an outbreak. So we have to tackle this problem by looking at the whole concept of One Health. And the Honorable Prime Minister has addressed this even a few days ago during his speech on the 15th of August. And I think this is another important issue which will come in the G20 summit. India is known as the pharma capital of the world. We are actually producing a large number of drugs which we are supplying to the world. So we need to look at how G20 summit we can actually focus a lot on universal health coverage. How can we be able to provide health coverage which is of good quality and affordable to the world? With newer drugs coming in, the cost of healthcare has gone up very significantly. And I think this is the fourth agenda which one needs to look at in terms of universal health coverage, where India can really take the lead. Another area where India can take the lead is digital health. We showed during COVID-19 how we could really look at telemedicine, teleconsultation, and even the CoWIN app, which was so popular and did so well, has been appreciated globally. So I think that is the other area where digital health can be used to really provide support in terms of digital health platforms which can be used globally with data sharing. And this can actually push a lot for research, whether it be research for vaccines, whether it be research for therapeutics or diagnostics. I think this is another area where there can be a big push during the G20 summit.
Absolutely. And amid the recent success of India in the health sector, the response that India had against COVID pandemic was applauded worldwide. So what lessons India can share with other G20 nations regarding the response towards the pandemic?
I think multiple lessons that India had. One was that there has to be a good collaboration between various stakeholders. This could be at a national level, it could be at a state level, it could be at an international level. Because when there's very good collaboration, there's alignment. And as we saw in India, that there was a very good alignment with the Prime Minister leading the way and the push being at all levels and everyone doing their bit. India was able to do much better than a large number of developed countries. So one is, how do we really develop a platform of alignment? How do we look at data sharing? And how do we look at digital platforms where India was able to do a lot in terms of providing information, treatment, and even then vaccine support as far as the digital platform was concerned. I think these are lessons that we learned. And the other lesson that we learned, and which I've already stressed upon, is India's ability to produce vaccines rapidly. We produced 2 vaccines in less than 1 year, and we have now large number of vaccine platforms which are available, which is what we showed the world, that we have the capacity to develop vaccines at a very rapid pace. Similarly, large number of drugs which were cost effective and of good quality. So I think the pandemic showed the capacity India had as far as the pharmaceutical industry was concerned, as far as R&D was concerned, and it also showed the capacity as far as digital health was concerned.
And Dr. Guleria, as we are talking about the capacity that India has showed regarding manufacturing vaccines at a very big scale, India is also a very prominent advocate of vaccine access to all countries, to everyone. So what strategies will India advocate to ensure that vaccines are distributed fairly and reach people?
I think this is a very, very important issue which should come up in the G20. And India already took the lead during the pandemic. And like you said in the beginning, with India's policy of Vasudhaiva Kutumbakam, we were able to really show the fact that we were sharing vaccines with neighboring countries, even from the very beginning. And I think the whole issue of how do we really develop a strategy addressing the issues of IPR and also the cost of vaccine so that no one is left behind. And what has clearly been said is that if you do not vaccinate everyone, no one is safe. So that is very, very important that India pushes for what it has been doing during the COVID-19 pandemic, that vaccine sharing should be equitable, they should be cost effective. And during an outbreak like this, or when there is a need, we should have a capacity to waive off the IPR, which becomes a hindrance during this point in time.
And amid the rising concerns about the population and the diseases that are coming by every passing day, there's also a rising burden of non-communicable diseases like diabetes, cardiovascular diseases, and cancers. Are there also policies or efforts in place that can be shared during the G20 for tackling these issues?
Yes, I think we are moving, although we have outbreaks and pandemics, but we are moving towards the burden of disease, which has already happened, that the burden of disease in India is predominantly for non-communicable diseases. Diabetes, hypertension, stroke, chronic respiratory diseases, cancers, these are causing a huge burden of disease. And they are chronic diseases. They are not like infections that you treat them once and they become all right. So there is a need to develop strategies which are being done in terms of preventive health. So I think the focus should also be to prevent or delay the occurrence of these diseases. So early screening for any of these diseases, that program is something that India is pushing, that all adults over the age of 30 should be screened for various chronic diseases like diabetes, hypertension, and for cancers. And this is something that one can do at a global level, develop a platform for screening and also early diagnosis. Good health, and India has led the way in terms of yoga. So by having good, healthy lifestyle, not only in terms of exercise, but in terms of your diet and in terms of other activities, which is very popular in India, like meditation, you could actually prevent many of these non-communicable diseases or delay their occurrence, and that will go a long way in tackling non-communicable diseases. Besides that, there's also an issue of developing affordable and good quality drugs for non-communicable diseases, whether it be for diabetes, for hypertension, chronic respiratory diseases. Here again, India has led the way by developing molecules and drugs which are of much low cost and of good quality. So I think there is a lot that India can show the world in terms of non-communicable diseases.
Absolutely. And Dr. Guleria, I think that you might agree with my next point that in order to find a solution for these diseases, there should be a more dedicated research, development and innovation process by all the countries. And now when India is especially leading in this front and trying to collaborate with G20 member countries regarding that, how do you think India will strengthen in this area?
So I do agree with you totally that as we move forward, we should have collaborative research and we should have a good research platform from the point of view of early diagnosis, point of care diagnosis for these diseases, good therapeutics, good drugs that we can give to people across the world, even those who are marginalized and are not able to get medications freely, and also develop other strategies in terms of prevention. So there is a huge focus, or I would say a huge opportunity to really look at R&D or research in these molecules or in terms of diagnostics, not only in India, but to collaborate with all the G20 partners so that one can share their knowledge and really develop strategies for early and proper treatment, which is affordable and of good quality for various non-communicable diseases.
In the light of the digital health revolution, how does India intend to harness technology and telemedicine to improve healthcare access? You do talked about how India is doing teleconsultations on it is helping the people broadly. And to mention here that India, in collaboration with the World Health Organization, will launch the Global Initiative on Digital Health on August 19th as the part of the ongoing G20 summit. So when India is already doing a lot, how we can do better in this regard?
So there are two things. One is the digital health data. I think India is already developing the digital health platform. We have now the whole platform where one, for all citizens of India, you can have your own health card and you can have your data on that, which is transparent and very secure, and patient has the right to decide whom can see his data or not. So that platform is something which can become not only for India but for the world or for the G20 countries. The other issue is to look at how we can harness technology for providing better healthcare, especially looking at remote areas or areas where healthcare is difficult to access. So we discussed telemedicine, teleconsultation, but also looking at wearable devices and new devices which can be used by patients to wear, and they can be monitored even if they are at a remote area using the digital platform. And in a similar way, drug delivery can be done using various other newer technologies like drones. So even during the COVID-19, vaccines were delivered to remote area using drones. So there is a lot that can be done in terms of healthcare, both in terms of delivery, in terms of digital platform, and in terms of looking at new digital devices which can be used to monitor patients and alert not only the patient but the doctor or the nearby hospital if the patient has a problem, and therefore there can be collaboration in terms of quickly shifting the patient to that area if he has a heart attack or if there is breathing difficulty or if there is a stroke, and proper management can be done using the digital technology platform.
As we are entering the concluding stage of our program, Dr. Guleria, I want to understand from you that given the interconnected nature of health threats and the climate change, in addition with the lifestyle triggers, how does India plan to work with other G20 nations to strengthen global health security measures and ensure a coordinated response to potential outbreaks or next epidemic or pandemic?
So two things. One is, as far as outbreaks are concerned, I think at a global level, there has to be data sharing and good surveillance. So surveillance for any outbreak or any cluster of diseases or any red flags which occur not only in a country but in the neighboring countries and in the world should be brought to the notice of other members, and a plan in terms of how do we prepare for any outbreak of that nature, how do we respond, and also looking at how can we quickly develop a vaccine or a drug to manage that new outbreak or new infection is something that needs to be done. At the same time, we also need to develop strategies as far as addressing the whole issue of climate change is concerned. What can we do to decrease the global carbon footprint? So what can each country do to really decrease its effect on the environment in terms of having better quality vehicles and other things, so that the health of the citizens is protected and we don't see the type of climate change effects that we're seeing nowadays.
On that note, we conclude the program. Thank you so much, Dr. Guleria, for joining us on Akashvani.
Thank you.
You were listening to a discussion on health priorities under India's G20 presidency. The participants were Dr. Randeep Guleria, former director, AIIMS, New Delhi, and Omvesh Upadhyay, anchor. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on a mobile app, News on AIR. This program is also available on a YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsttalks@gmail.com or WhatsApp on 9289094044.
आज की ताजा